Right, still going through with this section of the study design. We've looked at old public health, we've looked at the biomedical approach to health, and we started in the last lesson looking at this idea of the social model of health. And we also did look a bit at the relationship between these two models. What we need to look at, and this will take us a couple of sessions because there's a bit of detail in it, is this thing called the Ottawa Charter for Health Promotion. And this is a really important thing that you need to know, and you actually need to be able to pick examples of this in action, which is why we'll spend a bit of time on it. I just wanted to recap some of the stuff we did last week. So remember, we looked at this biomedical model, which is when healthcare is focused on diagnosing and treating conditions. It's very individually focused. It doesn't focus on the whole community. It's just on people that need treatment usually. And it's focused on kind of treating the condition and not the cause of it. On the other hand, we've got the social model of health. And this is what we sometimes call our new public health. And this is more focused on behaviours or factors that influence health and well-being, some of which we've looked at a lot in term 1. It's got to focus on the community, not the individual. And I guess that's where that word public health really comes in. And it's more focused at addressing the cause and not the condition. I showed you this graphic, which kind of compares the biomedical and social parts, or kind of shows how they work together. So if we look at the top at our public health, we had our old public health in the early 1900s, and that was to stop the spread of infectious diseases. It was really focused on physical environments and kind of cleaning up cities, having better sanitation, improving food, things like that. We've also now got what we call new public health, which kind of emerged in the 70s in response to our lifestyle-related diseases, things like obesity, lung cancer from smoking, certain types of cancer from alcohol use, from diet, from not having enough exercise. And then what's been going along through all of that is our biomedical model. Okay, so I guess a good way to think of it is public health doesn't replace the need for diagnosis and treatment and science, but the idea is if we can focus on these things, then hopefully we need less of this. I just wanted to go through 2 of the questions in last week's questions, because most people did really well, but there was a little bit of confusion on a few of them, and that's kind of what I expected, because it usually takes a bit of talking to understand these. So we looked at these principles of the social model of health. Okay, and this is basically what the social model aims to do to achieve its goals. So things like acts to enable access to healthcare, it empowers people, it looks at these broader determinants of health, or we might call them factors, things that we know really contribute to people's health status. Intersectoral collaboration, so I guess collaboration is that key word there, different groups working together, and also acting to reduce social inequities. And I gave an example here, and there'd be lots of different examples you could look at. But an example of, let's say, the government has decided to create a health app, and it sends people kind of healthy alert messages that are relevant to them. So what I want to do is connect each of these components of this program with one of these principles. So let's start with this one. So the fact that when they're making this app, the government have identified health issues that are important to different groups of people. So for example, they might be targeting, let's say we're looking at women, They might be targeting messages around things like breast cancer or ovarian cancer or things that tend to affect women more than men. So in doing something like that, it's addressing the broader determinants of health. It's acknowledging that there are a lot of factors that impact people's health. Same as age, they might say, all right, for young people, we know that mental health issues can be a really big thing for young people, a lot of stress. People can be more at risk of depression at a younger age. So we might target things based on that. So that's addressing those broader determinants. Now, to make this app, they're going to work with a private technology company. The government doesn't tend to employ people directly to make things like this. They'll send it off to a company and they can make this great user-friendly app. So this is an example of collaboration. Okay, the project is by the health department, but in order to get it actually going and to make it really good quality, they're collaborating with a private company to make that technology. Now, using the app to send health information as well as things like recipes and exercise programs to the subscribers. So this is actually how the app is working. It's sending people information. It's giving them knowledge. So this is empowering people. Okay, it's not just saying to people, you need to eat this. It's basically saying, we know that eating this can be really beneficial for physical and mental health and well-being, and here's some great recipes that you can try to take ownership of your own health. Okay, so that's an example of empowering individuals and communities. The app is provided to people for free, so it's not just for people who can afford it, and it's also got translations. So if maybe you don't come from an English-speaking home, you could get it in a different language, which means that people can access it. It's not costing any money, and they're making it easier to access in a different language. So this is an example of acts to enable access to healthcare. Access is not only about being in a physical location. It can be things like things that make it easier to access something. And then finally, some other stuff in the app is information about courses that people could do or employment opportunities, maybe some social support programs. So this is acting to reduce social inequities. Okay, so this is saying that we know that if people aren't engaged in employment or in study, or they don't have social support, that can affect their health. So can we link people with things or help them improve their situation, which will improve their health? Okay, sorry. Most people did quite well on this, but it certainly doesn't hurt to write these examples down so you can come back to it when we look at other examples later. Also just wanted to overview this, where I've given some examples. This is comparing biomedical and the social approach, or sometimes things fit into both. So attending the emergency department after you've been injured, that would be biomedical. Okay, that is, you don't go to the health department unless you need to. Okay, so it's not the emergency department, sorry. It's not something that everyone does. It's only if you're injured and you'll see a doctor and they'll give you treatment. All children must be immunised before they start school. You could say this is both. It's definitely social because it's addressing the entire community and it's making sure that people are protected. But if you think about immunisations, they require technology and science to have happened to create them in the first place. So with something like that, as long as you can explain your answer, you could go either way. But I would probably focus more on the social side of it because it benefits everyone, but acknowledging that it did require medical research to happen. Antibiotics get prescribed when you have an infection. That would be biomedical. Again, you don't just give antibiotics to everyone, it's only if they're needed. Laws to say that bicycle riders must wear helmets. This is a social thing, okay? And we'll talk more throughout this area of study about different laws and policies that promote health. But the idea behind this is that people are protected from injury. It's something that applies to everyone. Taking antihypertensive drugs to manage hypertension, and that's just high blood pressure, that is biomedical. Again, not everyone takes it, it's only if you need it. Being quarantined for treatment after getting the measles. This would probably be both. Okay, the treatment part of it is biomedical. Okay, you need to get treatment so you get better. The quarantine is a social response. It's to make sure that a disease doesn't spread further throughout the population. Then finally, free community exercise classes. That's a great example of a social program to help people. It kind of empowers them to take control of their health. It's available to everyone. It's not a treatment, it's more a prevention. Okay, we're moving into this kind of topic of health promotion, and we'll spend a bit of time on this. So in this lesson, you'll probably notice I haven't included a huge amount because I want us to make sure we understand each step of this, that we don't try and fly through it. The definition for health promotion is the process of enabling people to increase control over and improve their health. Okay, this is one of those things where you should have a definition ready to go, so make sure you've got this written down. Process of enabling people to increase their control over and to improve their health. If you needed to explain that further, you could add in that health promotion focuses on prevention rather than cure, and it uses the causes of disease as the starting point rather than disease themselves. That might sound a little bit confusing now, but as we look at examples, this should make more sense. But I guess a good example of this would be if we're saying we want people to increase their control over their physical health through, like the aim is to decrease rates of obesity. We need to look at what the causes of obesity are, and that's what we target. So a true health promotion program wouldn't target people that are already obese to lose weight. A genuine health promotion program would be trying to prevent people getting into that situation in the first place. Okay, so write down this, head into question 1. I just want you to think about what this means. Can you think of some examples of what this means in your own words? All right, we're going to spend a fair bit of time on this thing called the Ottawa Charter for Health Promotion. This is absolute must-know information. It's a big focus of this unit and also Unit 4. So the World Health Organization had their first conference on health promotion in the 80s in Ottawa, which is the capital of Canada. Good bit of trivia there for you if you didn't know. Okay, so Ottawa is a place. The Ottawa Charter is basically a framework or a guideline of things to help countries implement health promotion. Okay, so this charter was developed to provide a framework for developing health promotion programs. I think a really important thing to take note of right now, the World Health Organization doesn't technically make rules for anyone. And we'll look more at what they do in Unit 4, but it's good to know now. The World Health Organization doesn't have any control over countries, but they are the specialists in health. So they basically provide recommendations and advice and frameworks to countries so countries can have good health responses. And we'll look at a case study today of kind of how that works. In the Ottawa Charter, we have these, it can get a little bit confusing, and I'm just going to write this other bit down now just so you know that we're going to look at something else as well. There's 3 strategies of the Ottawa Charter, and that basically says these are the 3 ways in which governments can achieve health promotion programs. What we'll look at next week is these things called the 5 action areas. And this is part of the Ottawa Charter as well, but it's more to do with like kind of specific things to do. So just like I said, I don't want to cover the action areas at all right now. I just want us to focus on these 3 strategies. So the Ottawa Charter strategies. Number 1 is to advocate. Then there's enable and mediate. So we'll go through each one. If you want to pause here and have a little think, what do these words mean? And let's say, I'll use the example of, let's say we've got a health department wants to run a program on, say, obesity. Let's just use that. Okay, so the health department wants to target obesity, prevent obesity. What kind of things might they need to do to advocate, to enable, and to mediate? If you have no idea, that's absolutely fine. That's why we're going through this. Okay, so to advocate for something means to kind of argue for something, or to kind of sell something, to sell your point. So this strategy of the Ottawa Charter relates to actions to gain support from governments and society to improve health and well-being. So this is about getting people on board and understanding why you want to achieve this thing you want to achieve. These are some ways that that advocacy happens in health programs. Okay, so often things like media campaigns. Social media is a huge focus now. You often see kind of health messages on social media. Holding public events. So you'll often see there's things like, Diabetes Awareness Week, or, Cycling Week, which is promoted at getting people up and moving. So they would be examples of advocacy. Publishing research. This is a really big one. If the government or health department or even health organisations just came out and said, we've got to spend all this money and everyone's got to do these things so that they don't get lung cancer. If we don't know what lung cancer does, or how many people have it, or what causes it, people aren't going to care. You need to back up why these things are important. And another one here is lobbying governments. And that basically involves going to the government and saying, we think this is so important that maybe laws need to come into place. And a great example is with road safety and cars. In the 70s, so many people were dying on the roads, and that's when, health departments went to the government and said, we need seatbelt laws, we need speed limits, we need safer cars. These are things that must be brought in by law to stop people dying. Okay, so they're all examples of that advocate section. Then there's enable. So these are things that are done to ensure equal opportunities and resources. Okay, so there's still that equity focus. This includes things like making sure that people have equal access to education, employment, housing, food, healthcare. Some of these things are probably sounding a bit like a broken record now because you hear them so often. It's the same theme keeps coming through. You cannot have healthy populations if people don't have these things. Okay, so enabling access to those things. A big thing here is the aim is to focus on empowerment. And what that means is giving people the skills and the knowledge and the opportunity to provide these things for themselves, which is not always that easy. And that's why it's important that we still have systems like Centrelink and Medicare that support people. And we'll look at that more later. And then finally, mediate, not meditate, mediate. Now you may have at some point in your school life had a fight with your best mate and the coordinators pull you in and they say, all right, sit down both of you, let's talk this out. That's an example of a mediation. And it's not that different from what happens at government levels. Not everyone agrees on some things, on a lot of things, especially at government levels. So you get conflict happening. So an example could be, let's go back to the cars. So people saying, all right, well, we need to have speed limits brought in, we need to have speed bumps, and we want more police on the road doing breathalyzer tests. So that's what we want. That's going to decrease the number of accidents. But the police department say, well, we actually don't have enough people to do more road tests. And if we do, it means we've got less police out on the streets walking around. Or the Department of Roads might say, well, we don't have a budget right now to put lights on all the roads and to have speed bumps everywhere. We don't have the money for that. That would be an example of conflict between the different groups that are involved. Okay, an effective health promotion program aims to reduce or resolve these conflicts, and that will involve a bit of compromise. They might say, okay, well, you can't get your speed bumps this year. What we can do is pedestrian crossings for now because it's cheaper, and then we'll work our way up to that. Okay, so that would be resolving conflict with the ultimate aim of producing outcomes that increase health and well-being. Okay, I would recommend keeping this screen up. Question 3 is just summarizing what these strategies are. And then I've written a case study that I think encompasses these things quite well. And it's about coronavirus because it's the time that we live in. And it is actually a really good example of a huge scale health promotion program where, you know, they're acknowledging that COVID is caused by coronavirus, so we need to stop this virus spreading. Okay, it's a bit of a different example to other ones we look at, which are more to do with our lifestyle, but you could argue that this is a health promotion program because stopping this thing is going to prevent a lot of health issues. So pause this, have a careful read through that case study, and then I want you to pick examples out that relate to advocate, enable, and mediate. Okay, and you might think of some yourself that you have noticed or you've seen on the news that I haven't included. By all means, please include them. Okay, and that is it for today. Thank you.